Hi, this is Irene Owens, and I'm going to be talking about evidence-based practice in the next probably 30 minutes or so. I had a couple different PowerPoints that I have included in this week, just so that you know the important points. Important points are in Chapter 11 PowerPoint. I'm not going to be going specifically by that one because I think that this one gives a little bit more in-depth knowledge about evidence-based practice, and it is an independent short course for med-surg nurses, and this is where a lot of our questions come from, is our med-surg practice. So I just thought this was a little bit better slides than the book. It's about 20 more or so slides, so we'll see how it goes. This slide just tells you it was the American Academy, the Academy of Med-Surg Nursing, in accordance with the 2010 strategic plan. This was developed. So the very first question that they ask us is, why is evidence-based practice important, and why now? Well, evidence-based practice has been around for a really, really long time. The gap between practice and research is around 17 to 20 years difference. So a lot of our research that you see, you may have seen from 15, 20 years ago. However, people are still looking at that research and doing analysis of it, whether it's just review of literature, which is a specific way in order to do some type of evidence-based research. So you'll see that. You also look at the changing patient demographics that require new approaches to care, and basically that's just telling us that our standards have to be the same across the board. If they go to one place and one standard is different than the other, patients are very savvy about their care now, especially with computers. And also the evidence base for practice is rapidly growing, expanding, and it's very complex for nursing and other disciplines as well, because this evidence-based practice is not just for nursing, it's for physicians, for social workers, psychologists, anybody, the multidisciplinary team that we all deal with. So when we look at why is evidence-based practice important and why now, the same question. We look at how to search, how to evaluate, how to apply evidence in practice is still unknown by many or inconsistently used by a lot of us. And there continues to be a mismatch between what we know to be quality care and the quality of care that is delivered. Let me just give you some examples. I hate to say when I was in nursing school, but I'm going to have to tell you. We just did what our instructors told us to do. We were told that this is how it's been done, this is how the nurses do it, and this is how we do it. We didn't know how come. We didn't know why we were doing it that way. We were just told that it was that way. But that's no longer the case with evidence-based practice. You as a student and as an RN, because you are the leader of care, the provider of care, the planner of the patient's care as you go through the nursing process, it's important for you to make sure that you are the leader of evidence-based practice, because you want the best for your patient. It's all about patient care and making sure that the outcomes are good for our patients. So we need to make sure that that quality of care is standard throughout. And that's, I think, one of the major factors for evidence-based practice. Quality problems occur even in the hands of dedicated, conscientious professionals. You know that a lot can happen in a clinical setting, and even with the best of physicians, the best of nurses. So it's important that we have a base for how we practice quality standard care. Also, the burden of harm from the underuse, misuse, and overuse of care is staggering. In the United States, we're the most expensive form of health care. And, maybe for maybe, let's say this is one question that we could come up with for evidence-based practice. Is it always that we always order a CT scan for a patient that has headaches? That's the burden. Do we? We shouldn't be, because there's other reasons for headaches, but that gives you an example of what I'm talking about. The 2003 report by the Institute of Medicine, which the IOM is very important, and it talks about the health professions education, a bridge to quality, recommends that all healthcare professionals possess certain skills and competencies in order to enhance the patient care quality and safety. So all health professionals should be educated to deliver patient-centered care as members of an interdisciplinary team, emphasizing evidence-based practice, quality improvement approaches, and informatics. Informatics is computerized based care. There was also, and I want you to kind of make a note of this, there was also what they called at the time, which was over 15 years ago, the PEW Health Professions Commission. They were commissioned to get together to identify strategies to improve healthcare, and this was in the 1990s. And they identified as the competency for evidence-based practice was that all nurses contribute to continuous improvement of the healthcare system, that nurses and health professionals demonstrate critical thinking, reflection, and problem-solving skills, provide evidence-based, clinically competent care, and they take responsibility for the care quality and all the health outcomes at all different levels. So that was for the 21st century, and we are in the 21st century now. So as you look back on that commission statement, it is applicable as it was then as it is now. So it just gives you the purpose of this module and the 5 competencies to it. The objectives are next, and these objectives reflect the same objectives that we have for you in your syllabus. Okay, so this leads us to evidence-based practice it's basically knowing that what we do is the best practice. Simple as that. I love that slide. And look at the triangle, the improved patient outcomes. That is the center of what evidence-based practice is. So how do we know? And know is darkened and kind of emphasized here in nursing. Well, and I gave you an example earlier about tradition. Traditions have come down from our grandmothers, grand nurses a long time ago, because this is how we always did it. We always we always made sure that we listened to bowel sounds. Well, now we're finding out that they should have a bowel movement before they go home. That's a tradition in nursing. Also, how did we know in nursing? Authoritatively, our instructor told us, and this is how it's done. I can remember, just last year when I was in nursing school, that my instructor told me there's 3 ways to check for an NG tube placement, and that's to put the end of the tube in water. That was one way, and if it bubbled a whole lot, it was probably in the lungs. To make sure that you aspirate and that you listen. Well, putting the end of the tube in water is not is not considered one of the best practices. So, but my authority, which was my nursing instructor, I'll never forget it because I always think about her, and she's always like, you have 3 ways to do that. And that's not necessarily evidence-based. How do we know in nursing? We borrow from other disciplines, we borrow from each other. We also do trial and error. You know, it worked here, it should work there. Our personal experience, as we all know, helps and can hinder. You know, as we look at, is that based in research? Role modeling and mentorship, intuition and reasoning, and nursing research. Nursing research is the model, however, that we should be managing our patients with. So we look at nursing research and we say it's diligent, systematic inquiry to validate and refine existing knowledge and generate new knowledge that directly and indirectly influences nursing practice. Very important. We look at the Homan sign. All y'all know the Homan sign. You check for DVTs, and the cath, that was 5 years ago, that was what you did to check for DVTs. If the patient had pain, then you would tell the physician. However, now the Homan sign, when they've done some research on it, is not the all and end all for DVTs. So our practice has changed based on nursing research. So there's different types of nursing research. There's one that describes, that identifies and understands phenomena or an issue. So if in describing a patient with that has type 2 diabetes, we're going to describe what the difference is maybe between type 1 and type 2. Explain is to clarify relationships. You can clarify relationships with patients that are type 2 diabetic and they're taking insulin versus a PO medicine, a hypoglycemic such as metformin. The other is predict. You can estimate the probability of an outcome. You know, maybe if we did hemoglobin A1Cs, and this did happen, that we did hemoglobin A1Cs on patients, which is an average of a 3-month blood sugar, we estimated the probability of that being an outcome where it now diagnoses not just the fasting blood sugar or the postprandial, but it also diagnoses now hemoglobin A1Cs is used in diagnosis, and before it was not. Also, control, manipulate the situation to get desired outcomes. So this is when you have blind studies, when you do maybe some randomized control trials, which your meta-analysis of multiple randomized control trials is one of the most reliable ways to develop and evaluate evidence that can be used as a basis for evidence-based practice. So control trials are very important, and they deliver the best evidence for us. So we kind of talked a little bit about this, about much of what is known from research has not been applied in practice. And I think it was in your book, it said 17 to 20 years. There's that research and practice gap because of time restraints. And we're going to get into this about how come nurses aren't looking at research. But with computerized support, it does allow us more easier access to databases. It locates the most current best practice guidelines for us, and it also provides alerts pertaining to patient safety for nurses. So computers are our best friends at this point when it comes to research, because long time ago, before I'm sure my mama told me about it, was when we had to go to the library and get library cards, and then go through all these cards, and then go through all the go through all the journals, and then just to find out that the 8 hours of research that you didn't come up with anything. So there is a huge gap, but with computers, I think as long as we get into the computer, as long as we find out evidence-based practice, as long as we're curious as practitioners, I think that will go a long way in that, and maybe close that gap between research practice gap. This slide just tells us about the 80s and 90s. The nursing emphasizes bridging this research practice gap through the development of research utilization projects. Steps of the process included that they used were dissemination of knowledge, synthesis of findings, the critiquing of those studies, and application of the findings. Development of research-based practice guidelines. You can see at the Agency for Healthcare Policy and Research, conduction and utilization of research in nursing. There are also some practice protocols in there as well. So if there's a question that's been bothering you, there is plenty of research out there that you can look into. So even though the guidelines and the knowledge have been disseminated, which means that it's out there, it's there, the overall effect on clinical practice and patient outcomes is unclear because it has not driven yet our practice, which I think I think it has started the last 5 years, and I think it's going to drive almost every decision that we make in the coming years as you practice. The gap is also the problems of importance to med-surg nursing, especially your skin breakdown, pain, bowel function, treatment, adherence, nausea, and related interventions are largely not collected in these medical record databases. And the nursing research studies are predominantly descriptive or qualitative in design, rather than what is considered more rigorous. And we talked about the more rigorous studies being the meta-analysis of multiple randomized control trials. So we look at what evidence-based practice is. It's needed to help bridge the research practice gap by strengthening the evidence base so that we know what works and what doesn't work in providing patients with the best outcomes. I think you will see that in your care maps at the hospital, especially for our hip patients, hip and knee patients. A lot of that standard of care has changed based on evidence-based practice, and you'll see some of that when we go to the tower. We go to Tower 2 at Leesburg Regional Medical Center, and they are using the evidence that has worked with patients. And one of those, and I don't want to belabor this, but one of those is the patient has to get dressed. The patient has to get dressed. The patient has to go down and eat. They have a place that they can eat. They can't stay in bed to eat. So if vital signs are stable, pain is under control, they have PT, OT helping them, nursing is right there with them, using that interdisciplinary approach, they are taught right away how to dress themselves. So that has definitely changed practice since I've been at Leesburg Regional Medical Center, and that's been over the last 2 years that I've seen that. So also standardizing evidence across fields to reach the best outcome from the patient. And I think the example that I gave you is real important, because we have implemented that at Leesburg Regional Medical Center. Housing evidence in online databases, providing reviews of the evidence base, which is really nice because a lot of us don't have time to read the whole article. But what's nice is that we can do a review of the article, and if we need to have the whole article, then we have access to it. Translating and consolidating state of the science into clinical recommendations. So very important to take science-based. Remember that nursing is art and science, and utilizing that science as we go and we evaluate our patients and our care of those patients for better outcomes. So evidence-based practice is conscientious, explicit, judicious use of theory-driven research-based information in making decisions about care delivery to individuals or a group of patients, and in consideration of individual needs and preferences. So we look at our evidence-based practice, and we see that this comes not just from the theory, but it also follows different standards set by the ANA and by other professional organizations. This one that I'm going by the PowerPoint slides right now is from the Med-Surg Association, American Medical Surgical Association. So we also have the American Nurses Association to follow by, and we also have each other to deliver that care. So all the interpersonal, interdisciplinary plans of care that integrate the art and the science of nursing is important. So we have integration of best research, evidence, clinical expertise, and patient values in making decisions about the care of individual patients. So our key components of the evidence-based practice, our decisions about care, are based on research evidence, our clinical expertise, and our patient values and circumstances for that patient. So research evidence could be randomized controlled trials, which I already told you that's the meta-analysis of multiple trials randomized are the hardiest and the most reliable. The lab experiments, clinical trials, epidemiological research, outcomes research, qualitative research, and expert practice knowledge, inductive reasoning, for that outcome. Clinical expertise, it's knowledge gained from practice over time, and inductive reasoning as you go and you try to evaluate a patient's plan of care. Patient values or circumstances are unique. Their concerns, their expectations, their financial resources, and all of their social supports are all based in evidence and in research. And it is important that one research article or one research trial may not meet the needs of the patients that you basically are taking care of. Those samples have to be representative of the patients that you're taking care of. So just remember that those unique preferences are important as individuals that we take care of. So, what are some of the benefits for med-surg nurses? Well, there's fewer errors. There's reduced likelihood of making a type 1 and type 2 error in practice. A type 1 is acceptance of a practice that is incorrect, and type 2 is rejection of a practice that is correct. They give you some examples here: administration of a wrong dose, utilizing the type 1 procedure, and teaching patients using the wrong information. And the rejection of a practice that is correct is failing to screen patients for falls or pressure ulcers, failing to wash your hands before and after contact, or failure to provide patients with smoking cessation information. So the benefits for evidence-based practice is that we can reduce those type 1 and 2 errors. we commit overtly, or that we commit and we just make mistakes. So benefits for med-surg nurses: there's greater professional satisfaction from working as a team and experiencing effective practice. Better care is also, and it goes back to consistency in care. There's less variation in care among caregivers where knowledge for improvement is already available. It's more predictable in health outcomes for the patient. There's less waste and inefficiency, yielding fewer delays in diagnosis and treatment and fewer complications for the patient. This basically is just a little picture of the 5 steps of evidence-based process in judging the evidence and determining the circumstances and patient values for guiding that application. And the evidence-based process steps, assess the practice. So you have to formulate a question. In your book, in chapter 11, it goes over how to formulate a question. And table 11-2 gives you kind of an example. It's called a PICO. It's an acronym used to describe a format of the 4 elements that are required to formulate a good question. You have to have the patient or the problem, which is the P, the intervention, which is the I, the comparison intervention, and then the outcomes. So when you assess what isn't working and what do you want to know about, then you decide the evidence review, what resources are available, and are they any good? What has worked in other places, and how can you change your practice with it? Then you make your plan. Kind of sounds like the nursing care process. You develop a plan based on your findings, and you intervene. You take the action to review, process, or change, and then you evaluate how well has that been working for you. I think the most important part of evidence-based practice is that you, as a clinician, should always be curious enough and make a commitment to your patient that you are going to deliver the best possible care to your patient. There is a web link that I've put on, I think it's in your evidence-based research in week 5, and it's a toolkit. And in that toolkit there is it's called a TRIP database. If you click on that, you can register and it's free. And it gives you some down and dirty synopsis of different questions that you may have had in clinical, which I think are very important, and we'll be utilizing those throughout the year as we're looking at patients and if that's the best outcome and the best care for that patient. Okay, I think that ends evidence-based practice. Good luck. Thanks.